Hi, I'm Dr. Rahul Bharad. I welcome you all to my series What Life Has Taught Me Yesterday. Today when I'm recording this video is 22nd of October 2023. I'll be talking what 21st of October has taught me in life. Being a doctor, being a pediatrician, I come across many patients of dengue fever day in and day out in our OPDs, in our IPD patients. We come across this situation. Various levels of severity are present in some cases. Most of them get cured so well, but very few have that unfortune that they succumb to the dengue fever. Dengue is very deadly disease. I'm not trying to exaggerate things here, but I'm not trying to scare someone about dengue, but I'm also trying to mention what dengue can cause if it becomes serious in any condition. So what lesson I got from yesterday's life, I'll be discussing about that in this video. Most important news I came across yesterday is about Gaganyaan test flight, as it was delayed and postponed yesterday around 8:45 a.m. It again was rescheduled on 10 a.m. and it was successful. Prime Minister Narendra Modi has congratulated ISRO and all the team of researchers, so that this is the important step in sending crew members actually into the space, and that would be the first time India would be sending our space people into the astronauts into the space. Most trending news I came across yesterday is about World Cup. ICC's Cricket World Cup is happening and two pitches have been given average weightage and average rating by ICC. Those two pitches were one where India played against Pakistan at Narendra Modi Stadium, and another pitch when India played against Australia at Chidambaram Stadium at Chennai. So these two pitches were given average rating by ICC referees, and to that our coach Rahul Dravid has disagreed, and he has said that both the pitches were quite good and other team, that is Australia and Pakistan, were not able to perform well on that pitch where Indian players scored runs quite well. So based on that, what is the discussion I'll be discussing at the end of this video. Most important lesson I got from yesterday is about coming across a case where the patient had very severe dengue course. Now dengue is something which is transmitted from it is caused by a virus and it is transmitted by mosquito from one person to another. Dengue is not something which is completely rare in India. You might have come across this situation, probably you might have suffered also if you are from India, and many children get dengue fever. Most of them recover quite well without any complications. They are called dengue fever, where they will have fever for few days and they will have weakness or abdominal pain or vomiting, sometimes generalized weakness, and they will recover with all the treatment given by their doctors. Some of them have hemorrhagic fever, that is somewhere in the body they will bleed because of low platelets or because of complications of dengue. That's called dengue hemorrhagic fever. And deadly complication of dengue is dengue shock syndrome and other multi-organ failure, etc. So very few children get these complications. To learn from that case which I came across yesterday is the thing that a complicated dengue can be devastating, it can be very dangerous, and it can be very rapid. Especially I think most of the time age is an important factor, because those children who are in their early infancy, I guess less than 6 months and all, and those children who are in their adolescent age group, they are also, both these age groups are very much prone for few of the complications. I am not pinpointing what is the reason behind that, but what I have observed as a pediatrician, that these two groups have more chances of complications. So all the parents must give attention to these children. They must look into the matter very seriously whenever they are having signs and symptoms of dengue, or they are having dengue fever as a proven lab test condition. So what are the serious conditions and serious symptoms parents and all the patients of dengue must look for is severe lethargy, repeated vomitings, severe abdominal pain, any kind of bleeding, low kind of feeling and drowsiness in the patient. These are all complications, plus respiratory distress, that is difficulty in breathing. These are all severe complications of dengue. Whenever you come across these signs and symptoms, please go and visit the doctor again. In case, though, even if the patient is seen by the doctor a few hours back or few days back, you must visit the doctor again. Do not hesitate to visit the doctor. I am saying this just to reiterate the fact that dengue is very fast progressive sometimes. Even if a child is seen by the doctor in the morning, the child can land up in complications by evening also. So it's not that it will take few days, like 2-3 days for complications to happen. Most of the time things go very bad and very fast. So it's a humble request that all the parents should consider these danger signs and should look for these danger signs. If at all they appear in their children, you must visit your own doctor or child's doctor as early as possible, so as to avoid further complications. And please follow all the advice given by your doctors. Do not try to learn from blood reports, etc. It takes years for doctor to understand what is there in the report. So don't try to make your own conclusions just by looking at the platelet numbers or WBC numbers or whatever numbers you want to understand from half knowledge. Half knowledge can be very dangerous. So it's humble request that we must pay attention to all these danger signs, and probably that was the most important lesson I got from yesterday's life. Most important news I came across yesterday is about Gaganyaan. Gaganyaan's test flight has been successful. Yesterday it was successful. Earlier it was withheld at 8 am, then 8:45 am because of the technical problem which was discovered by the onboard computer, but finally it was successful at 10 am. Prime Minister Narendra Modi has congratulated ISRO and the whole team, especially S. Somnath, who is the chief of ISRO. That is a wonderful step and the initial compulsory step for sending actual astronauts into the space, which is planned probably in the 2025. India is planning to even send human beings on the moon by 2040. That is 2040 year, 17 years from now. India is planning to send human beings on the moon, and in 2 years India is planning to send their own astronauts into the space with the help of the mission called Gaganyaan. So all the preparatory lessons we are doing correctly, ISRO is doing correctly. So we all should be proud of ISRO that they are on the path to achieve what they are planning to achieve by 2025. Most trending news I came across yesterday is about ICC Cricket World Cup's discussion. ICC had given average rating to two pitches in which were used during India-Pakistan match at Narendra Modi Stadium and India-Australia match at M.A. Chidambaram Stadium, Chennai. All other pitches till yesterday were given good and very good ratings. To this, Indian coach Rahul Dravid has disagreed, and he has mentioned clearly in his interview that ICC should not focus only on those pitches where 300 plus runs are scored. ODI one day international match is all about batsman, bowler, fielder, etc. It's not only about batsman. So don't think or judge a pitch based only on the runs scored. In India and Pakistan match, Pakistan got all out for around 191, and in India-Australia match, Australia got all out for 199 runs. On the same pitch, while batting second, Indian batsmen scored all those runs very fast, and that pitch was quite good for the batting. So we cannot comment based only on the collapse of the batting side about a pitch. So that's a simple message Rahul Dravid has given, and that's correct also. I feel Rahul Dravid is correct when he is saying that it is not the runs which should be counted for evaluating a pitch. It should be both ways. What happens in Dharamshala, we'll have to wait and watch, because today India is going to play against New Zealand at Dharamshala in their league match. What you people are learning from your daily life, please like, share and subscribe to my channel. Do tell me in the comment box what are you getting more by watching these videos. Till then, bye bye.